Hello everyone and welcome to this audio podcast. In this series, the Excerpts Equipoise chapter. This is the Shientist and this is another Storm Robotics production. Today I'm going to provide an overview in and around therapeutic drug monitoring, or TDM, in CKD, and it's a quant perspective, quant perspective on drug dosing nephrotoxic medication. And so the excerpt around this is wherein is as the introduction. The CKD is characterized by the gradual loss of renal function or kidney function occurring over months or years. This loss of renal function is assessed through stages by using a patient's glomerular filtration rate, a glomerular filtration rate. And once there are renal replacement therapies, or RRT, treatment aims to ease the symptoms while slowing disease progression. A common issue is preventative drug dosing. Drug dosing can be problematic since CKD can be linked to physiology deterioration. The aims and objectives around this work was to identify smarter ways to monitor individuals who are suspect or at high risk for renal impairment, to understand the importance of TDM, and three, to understand best practices to prompt early screening. This works. The design and methodology around this work was where this work seeks to assess a TDM and drugs that are associated with nephrotoxicity specifically. Data would be identified and literature would be critiqued. In addition, this work seeks to focus how health professionals and patients could be working together to improve healthcare. And the results around this was understanding pharmacology and pharmacokinetics of specific nephrotoxic medications to monitor drug therapeutics is important in any biochemistry laboratory. Armed with appropriate knowledge, data analysis should enable health professionals to link patient-centered care so that when prescribing drug metabolism, distribution, excretion, and absorption rates are better acknowledged to preclude acute kidney injury. The discussion around this is that without effective monitoring and dosing modification, therapeutic drug concentrations can lead to therapeutic drug inefficiency. Particular drugs that are administered have a narrow therapeutic index, requiring constant, accurate therapeutic drug monitoring. And so the conclusions around this is that a more accurate quantitative approach to TDM could benefit CKD patients, improving quality of life during treatment by significantly reducing levels of toxicity and drug reactions, whilst improving future pharmacotherapeutic outcomes within CKD treatment. The summary around this is that the pharmacokinetics, according to nephrotoxic medication, fluctuate, and methods used to monitor therapeutic variability. Having a pharmacology basis to better understand better healthcare delivery, and precluding nephrotoxic side effects as much as possible is essential. So some terminologies that can be linked to the literature using specific databases include biochemistry, therapeutics, pharmacology, screening, and nephrology. And so the acknowledgements around this excerpt are to Equipoise, wherein there was a collaborative effort between an academic institution and the Renal Patient Support Group, the RPSG. Once again, the excerpt here was around TDM in CKD and a quant perspective on drug dosing nephrotoxic medication. And once again, this was a Storm Robotics production.